The first thing that I want to do is I want to select a patient on my schedule. So I'm going to go ahead and select David Blackwell. That opens up his chart. If the intake hadn't already been done, I can click on the intake button and enter his intake information. So I'll say he's 239 pounds, put in a blood pressure, and I'll go ahead and click save. Now from here, one of the first things that I want to do is I want to select the problems that I'll be addressing. So the chronic problems are on his problem list. I can click the select button there. That opens up an HPI window. So I can enter my HPI for diabetes from here. I can click the previous history button so I don't have to start from scratch. So that pulls over the last time that I documented his history. I can make changes here and I'll say he's not compliant with his diet and he's only exercising 2 times a week. If I wanted to use speech recognition or type history instead of having the computer generated text, I could do that either in addition to clicking on the values that I've done or by itself. I'll go ahead and blank that out and take that out of my HPI. Go ahead and click save. The next thing that it does is it opens up AutoVisit. AutoVisit is a window that brings together in one window everything that it has learned that I like to do in relation to this family of problems. So I selected diabetes, and so it presents to me all of the issues that are pertinent for diabetes. HbA1c appears in red because he is overdue for one. And so I will click on HbA1c. Anything else that I want to do, I can do at this point. I will tell him that losing some weight would help, and that's all that I need to do at this point. So go ahead and click OK, and then the system begins to generate the note. So from here, I have a list of buttons up on the top, and it begins to generate the note based on what I typically do for this type of problem. I have these hyperlinks here that appear in blue, and I can click on them. So my heart exam gave me my default heart exam, but if there was a murmur or his rhythm was not regular, for example, I could click on heart. That opens up my heart exam form. From here, I can simply make some changes. I'll give him a 2/6 systolic murmur in the right upper sternal border, and I'll say that it is musical and it radiates through the apex. Click save there, and you can see that it begins to generate my heart exam all over again. I will go back to the overview page, and if I'm addressing diabetes, I'll probably also address hypertension. When I click on select, it selects a problem. It opens up a cardiac or a hypertension follow-up form. I can go ahead and document that. I will leave that alone for now. Then it opens up a hypertension AutoVisit. So again, it presents to me everything that I would want to do to address this problem. Now, if you don't want AutoVisit opening up automatically when you select a problem, that can be turned off. I can always reopen AutoVisit by clicking on the AutoVisit button here. So if I click on this one, it opens up AutoVisit for diabetes. And I can go back in at this point. I'll say, let's give them a Pneumovax and urinalysis, and click OK there. And then if I click on this one, it will obviously open up hypertension. So going back to overview page, I will also address hyperlipidemia. So I'll click select there. That opens up a cardiac follow-up form to document my HPI for this problem. I'll go ahead and click save there. And then it opens up AutoVisit again for for items related to this problem. I'll go ahead and select whatever is appropriate there. Again, I can open up AutoVisit at any time. But as it's going, it's documenting my note as I go. Now, one of the things that I may want to do is looking at his medications at the start of the visit. I can go back and I can make a change. So if I want to change metformin, change the strength, I'll click on the little button there and I'll select change strength. And then it presents to me a list of all the varieties of metformin, and let's put him on 750 extended release. I select that. It opens up my medication window. And from here, at this point, I don't want to change anything. I already changed the strength. But if I wanted to, I could change how many per dose or the frequency. If I say BID there, notice that it does automatically generate the text. I can manually type in here if I want to, but I probably don't want to do that. It's easier actually to just have the system generate it for me. Nothing else to change there. If I want to submit this to its pharmacy right now, I can click submit, but generally I don't do that in the course of a visit, because when I close a visit, it's going to submit all of the scripts and any orders that I did at the end of the visit. So I'll just click save to do that. Notice that it crossed off the 500 milligrams there of metformin, and it shows it in gray. And if I go back to my note, I can either click today's note here or click the note tab there, and it will bring me to my note today. And it shows that metformin 500 was discontinued and the 750 was started today. That also shows it in the assessment and plan here. I actually did it for hyperlipidemia in this case, and that's because the problem that is currently selected is hyperlipidemia. So at this point, it assumes everything that I'm doing is related to hyperlipidemia. So I want that actually to be related to diabetes. So to change that, I will open up the assessment and plan window, and then I am going to uncheck hyperlipidemia is selected. So I want to unselect change metformin there, and I want to switch to diabetes, and now I want to check it for that. And so now if I click save and I regenerate my note, you'll see that it moved that metformin from hyperlipidemia to diabetes. In general, it's a good idea to try to remember to select the problem first before you do anything, because any order that I do, the system will assume that it's related to the problem that currently is in red. Now at this point, I have already selected 3 chronic problems. If I want to select an acute problem as well, I can see that the nurse entered that he also has an acute problem. I can go to my note for today, and I can open up my diagnosis encounter form, and this gives me a list of my acute problems. So from here, I can go ahead and select any acute problem. I'll just go ahead and select pharyngitis. That opens up a respiratory history form for me to document the HPI. I will skip that for now. It opens up auto visit. I could go ahead and select spirometry if I wanted to. Again, I can come back to that at any time. And it continues to document my note. Again, if I want to open up any part of the exam, I simply click on the hyperlink in the note that opens it up. If there's a part of the exam that I want to open up that isn't in my note, I can click the exam button here and select the one that I want, and that will open up that form. Anything I want to order, I can click the auto visit button, that opens up auto visit, and hopefully I will have my everything I want to see right there. If not, from auto visit I can collect, for example, if there's a lab that I want to order that isn't here, it hasn't been associated with this problem yet, I can click this button, and that will open up my lab form, which is a user-defined list of all of my common labs. The same goes through for instructions and imaging orders and anything of that like. I also can open them up from here. So I've got my order forms here. I can click on lab here, and that will pull up that same list there as well. Remember that anything I order, by default, is going to be associated with the problem that is currently selected. If I want to do a review of systems, I just simply click on the review of systems form, and that opens up my form. I've got review systems here, and this is my default, so I can click on within normal limits, and that answers all the questions to no. I will just say yes to weight gain, and then I can do whatever systems I want. Unspecified means I didn't do it, so don't put it in my note. So I'll just do a couple, and we'll go over here. We'll do musculoskeletal, and he has had some joint pain, and we'll do neuro as well, and we'll do psych as well. And he's been a little bit anxious and depressed. So I'll click save, and then that generates my review of systems. One of the things I may want to do is looking at his table of contents, and I can see his most recent lab result. This came in electronically from the lab. When it came in electronically, it also posted it to my flow sheet. So if I go to my lipids flow sheet, I will see that the values were parsed there. If I want to include that in my note, I just simply click on it one time. As my data continues to grow, I'll get multiple columns here for data that has come in. I'll click include here, include it in today's record, yes. Now if I go back to today's note, we will see that it put the values of that in my note. The last thing that I want to do is I want to close the visit, and that's the last thing that's actually a part of the visit proper. So I'll click the close visit button, and then it's asking me to select an E&M code, level 3, level 4. We'll pick level 4. These are the nurse orders that I ordered, and so this is going to send a message to the nurse to indicate that there's more that needs to be done for this patient. And what I always want to do is I want to indicate when I want to follow up, and I'll say I want to follow up in 3 months. If the patient was due for a physical, CPE would appear in red, and I would simply click CPE. That would tell the front desk that I want to go ahead and do a follow-up visit, but I want a physical in 3 months. I'll go ahead and click save there, and then the lab requisition would normally print out, or it'd be sent electronically if you have a bidirectional interface with the lab. Checkout slip is optional. Some practices like to print out a checkout slip. Now my note is complete. At some point I want to sign this note. I can do that now, or I can come back and do it 3 weeks from now. But I will go ahead and do that now by clicking the sign note button. It'll ask me to confirm it, and I'll say yes, and it signed it, time and date stamped it with my name, and now my note is complete.